So we're going to talk about the mind-gut connection. So what is this mind-gut connection? And as I said, it's not just metaphorical, as we were talking about before. The gut is often referred to as the second brain. And you're going to see why that is, because there's a huge part of our nervous system that depends on what's going on in our gut. The brain and gut are connected by extensive network of neurons and a highway of chemicals and hormones that are constantly providing feedback to each other. And this kind of highway is called the gut-brain axis, and it's constantly updating each other. The gut's updating the brain's updating the gut. How do you feel? How should I be feeling? What neurotransmitters do you have for me? All that kind of stuff. So this little, I think I have a little thing here. This is awesome. Okay, so this little, well, it's large on this screen, isn't it? Picture here, we're talking about the gut-brain links here. And the vagus nerve is one of the largest nerves in the body. It's a cranial nerve, which means it comes directly from the brain, but it controls so many things. It's one of the nerves that is not under our conscious control. So it's not as if we can say, bend your arm and it bends. The vagus nerve is sending signals from the brain to the gut and vice versa. The immune system, what we call short-chain fatty acids, which are these things that the bacteria actually make in our gut as they're digesting the fibers and stuff in our food. And the body uses those short-chain fatty acids for all sorts of things to make neurotransmitters and communicate. So all of these things are these gut-brain links. And tryptophan, which is the precursor to serotonin, most of people are familiar with what serotonin is. I very kind of simply put that serotonin is our happy hormone. It's actually a neurotransmitter. It's not a hormone, but we need that serotonin to feel happy, to have an increased mood, amongst other things. And 90% of that is made in our gut. So when people come into me with anxiety or depression or other types of mood disturbances, one of the first places I look is the gut. And sometimes people don't really understand why I'm doing that. Like, I'm coming to you for anxiety. Why are you talking to me about my gut? And one of the big reasons is a lot of times those things start because there is some sort of imbalance in the gut.